Hi guys, it's Doc Zero here, and today we're going to delve on the Leptospirosis Guidelines in the Philippines. This lecture has been requested by people on Facebook. I'm going to do it in 5 parts, only here on YouTube. We will be discussing today part 1, or background information. If you're subscribed, every day we'll be posting the other 4 parts, and it's displayed right here, where in part 2 we'll be going antibiotic prophylaxis. Part 3 will be interim statements on the role of antibiotic chemoprophylaxis in leptospirosis. Part 4 will be doxycycline drug information, and part 5 utilizing the DOH Department Memorandum 2009-0250. So let's start with the basis for this presentation. This Leptospirosis Guidelines was actually written by then and now Secretary Dr. Francisco Duque III. So it was issued last October 16, about 9 years ago. The title remains as the interim guidelines. The Department of Health in the Philippines always issues these interim guidelines during disasters, or what we call as a code red, wherein there is a massive surge of patients with a certain infectious disease. Now, 9 years from its making, there is still no final guidelines. This is just a department memorandum. It has not been changed ever since. The way the health department handles the problems is by issuing this department memorandums, wherein all other departments or agencies concerned will be given this department memorandum and is supposed to follow it as if it was law. So the purpose was because back then, 2009, the Philippines, our country, started to experience very large typhoons. This is all the effect of climate change. Back then, there was no color-coded scheme, and they just called it as torrential rains, which is, I believe it was 70 millimeters per hour, which is now called as the red rainfall alert by the Pag-asa, or our weather bureau. Local government units have already reported an increasing number of cases of leptospirosis from different evacuation areas and affected communities, with members of the community admitted and managed in various hospitals. Many of the LGUs have requested for this document because there was a massive surge of patients presenting with suspected leptospirosis. They wanted a way for the cases to be lessened. Both the DOH and local government units have agreed to work closely together in preventing and controlling any disease outbreak that may occur in evacuation areas and in affected communities. By providing prophylaxis, you can prevent outbreaks from happening. Leptospirosis, for those of you who don't know leptospirosis, it's a bacterial disease affecting both humans and animals. Back then, there wasn't much information about leptospirosis. Humans are actually considered as an accidental host. Most of the time, it's a freshwater bacteria that thrives undetected on wild animals. They listed the following as early stage symptoms. Unfortunately, this is actually the complete stage of leptospirosis. Early stages actually is asymptomatic. There is no symptoms. It can vary from no symptoms, high fever, severe headache, and muscle pain. I highlighted those 3 because that's actually the early stage of the disease, which we know now. The others are showing signs of septicemia, or more bacterial growth in other organs, which will present with chills, redness in the eyes, abdominal pain, yellowing of the skin or jaundice, and hemorrhages in the skin and mucous membranes, which is what it looks like petechial rash that is almost identical to dengue. When you look at even the gastrointestinal symptoms, vomiting and diarrhea also mimic dengue. There's a diagnostic dilemma most of the time. This leptospirosis disease is mostly diagnosed clinically, especially it's suspected after the patient wades in floodwaters or works in an environment such as like rescue workers or workers handling trash. If you get a good history, you may suspect leptospirosis, and instead of treating for dengue, you'd be treating with antibiotics and treating leptospirosis instead. Leptospirosis is caused via a pathogenic leptospira species. Additionally, there's 2 leptospira species, a saprophytic type and a pathogenic type. There is various serotyping done, but the serotyping does not equate to the overall severity. They just called it pathogenic Leptospira species, which is this Leptospira interrogans. So it doesn't matter what serotype it is. With reference laboratories, they still do serotyping just so for research purposes and possibly for future guidelines so that they can predict. But studies right now, they say that it doesn't matter what serotype, the presentation may still vary from person to person. How is leptospirosis transmitted? Leptospirosis occurs through the direct contact with the urine of infected animals. Just contact with the infected urine gives you risk, or by contact with a urine contaminated environment. The Department of Health listed surface water, soils, and plants. Leptospira thrives in a freshwater environment. In surface water, infected with leptospirosis through the passage of urine by infected animals, it can stay for a very long time. In soils, it can stay there for about 30 days. In plants, there is no study yet in plants, but if the soil is moist and in tropical and temperate regions, plants may provide transmission, especially for herbivores such as cattle. It's passed down from animal to animal. Leptospira bacteria can be attacked by the animal's immune system, but once it reaches the urogenital tract, it can live there, and the animal can stay as a carrier for life. The most effective carrier are the rodents. The others are the insectivores, the dogs, the cattle, the pigs, the horses. This results in an epidemic-prone zoonotic disease that can be transmitted by direct contact with contaminated water. Leptospirosis occurs worldwide. This is a map courtesy of google.com. You can see here that leptospirosis thrives where there is fresh water. You can see that Sahara doesn't have leptospirosis in it. As long as there are trees, there is rivers, leptospira is effectively transmitted. It's an occupational hazard for people who work outdoors or with animals. Some of the animals today are getting vaccinated for leptospirosis, especially the domesticated animals like dogs and cats. Sugarcane and rice field workers in the past have had leptospirosis. That's why the Department of Health placed plants there. Farmers, sewer workers, veterinarians, dairy workers, military personnel. Military personnel because they're usually the ones who are first responders during disasters. Other occupational hazards I can put in here are actually our first responders, the firefighters, the policemen, the ones doing public safety, what we call the tanod or the purok leaders, direct their constituents towards safety. They are exposed more to leptospirosis because they have to wade in flood, they have to go landslides created by the torrential rain. So those are additional occupational hazards that we can see here in the Philippines. Recreational hazards, swim or wade in contaminated waters. This is due to leptospirosis outbreaks after ultramarathon events, like the one discussed most in books, like the Sabah Borneo ultra marathon stuff, wherein contestants actually waded a river, and just having one gulp of the river water, you are already like having 50 to 70% risk of getting the leptospirosis during that event. So there was an outbreak, adventure run, so that's why they placed this recreational hazard in there. Leptospirosis is effectively transmitted by rodents. In here we have a rat. It's in Filipino, but translated that even rats are scared of leptospirosis. This is a funny slide. This is a funny picture that was shared on Facebook. So I kind of like to share it with you guys. Rodents shed a large amount of leptospirosis in the urine. Rodents are very rarely affected by leptospirosis. It's also an animal disease, so some animals die from it. Just so happens that rodents have a very good immune system, since once the bacteria transfers into the urogenital tract, it stays there and they become chronic care. The transmission is usually through contact of the skin and mucous membranes with contaminated rodent urine in water, damp soil, vegetation such as sugarcane. Again, they stressed again on sugarcane, mud, and also on mud. In the Philippines, mudslides, rock slides, landslides, they happen. They happen usually during torrential rains. or a red rainfall warning. So it peaks during the rainy season. Most epidemics happen after a big flood. In here, Department of Health just actually listed only flooding as a disaster that puts people at high risk with leptospirosis, because it facilitates the spread of the organism because of proliferation of the rodents. The rodents, for survival, transfer from one house to another, can swim very well. If they urinate on the floodwater, as you can see here, even few rodents can affect almost all of those people here in the back, here in the foreground, who's wading in floodwater. This is actually a Philippine picture. Residents have to go back to their homes after they got stranded. Usually shared ground, rodents want to find safe. They usually go where the humans go, so when humans are transferred to evacuation centers, you can expect the rodents also to be there. Similarly, the rodents to humans on high ground, or such as evacuation centers, the evacuees at risk for having leptospirosis. Risk is high in the Philippines because of poor sanitation. This was true 2009. This is still true today. We and the public health have been increasing our efforts to have good sanitation. Unfortunately, because of the low resources of the people, the customs, also because there's a increase in informal settlers in urban areas, it's hard to make people follow sanitation codes in squatters areas, what we call squatters areas, or depressed dwelling. And there are frequent typhoons. Most of the population affected are usually who are informal settlers. Expansion of flooding areas in the country because of the ever-growing large storms. Now, 2009 there was no signal number 5. Today there is signal number 5 because of after Typhoon Yolanda. Every agency now has increased sensitivity to disasters. They upscaled their responses, so whenever there is a super typhoon, a typhoon, or a habagat flooding, there is increased need of relief, and there's increased need of these guidelines to be formulated. I know I've discussed a lot, just a few slides just for background information. So next video we'll be discussing the plan of the DOH for providing antibiotic prophylaxis. So the DOH issued this department memorandum, so stay tuned for the part 2 of this lecture. I know I've said a lot, but if you want to continue, you need to subscribe to my channel or just wait for it. It'll be uploaded. Hope you guys learned something today, and hopefully you stay tuned for the next part of this leptospirosis series. Make sure to subscribe to my channel. Thank you very much. Peace out.